Welcome. I'm Betsy Abramson, the director of the Wisconsin Institute for Healthy Aging. I'm delighted to be talking with you today. This webinar is for potential leaders, registered program providers in Wisconsin, and other partners interested in high-level evidence-based health promotion programs. The Wisconsin Institute for Healthy Aging was formed to advance both the spread of evidence-based prevention programs throughout Wisconsin and the nation, and to encourage and support healthy living through partnerships with public and private organizations. We have a research arm that's hard at work designing, developing, and testing new interventions. And WIHA is also a clearinghouse and support center for many community-based workshops and programs that promote healthy aging and healthy living. As you'll learn from this webinar, WIHA provides many services and tools to support you and your partners in increasing access to these programs in your local communities. Have you ever seen this? It was developed by the University of Wisconsin School of Medicine and Public Health. It shows the 4 factors that are considered the determinants of health: individual health behaviors, clinical care, social and economic factors, and physical environment. Look at it here in this pie chart form. What generally surprises folks most is that clinical care impacts only 20% of your health. The biggest impact on our health comes from those top 2 slices of the pie. Our own individual health behaviors at 30%, and note that that is bigger than clinical care, as are the social and economic factors, which is 40%. Our evidence-based health promotion programs fit squarely in that 30% slice, individuals' own health behaviors. The Wisconsin Institute for Healthy Aging programs help people learn how to better manage their own health through the knowledge they gain and then their own goal setting related to exercise, diet, weight management, medication adherence, socialization, their own home environment, how they interact with their healthcare provider team, and how all that will affect health. What do we mean by evidence-based health promotion programs or prevention programs? These are programs that reduce chronic diseases and falls. It's important to know that many issues adults face are highly preventable, like falls, chronic disease, complication from chronic disease. These programs can really turn the tide. They improve quality of life and health behavior, health and functional status, and overall well-being, as well as confidence in managing your health. And they reduce healthcare costs. These programs also help form community partnerships. Community organizations and healthcare entities can partner to implement evidence-based health promotion programs because making strong community clinical linkages is integral to promoting good health and reducing disease and disability. Let's look at the slide's 4 major points in defining an evidence-based health promotion program. First, it's a proven program that promotes health and prevents disease. Second, it's based on research, science. It's been proven. And at WIHA, we only accept and administer programs that meet the gold standard of research, in that they are tested with a control group and an intervention group, and our scientific evaluators have reviewed the data and concluded that the program works by comparing the results from the 2 groups. Finally, these are packaged programs. They have carefully designed training programs for the leaders, and they are based on a very carefully designed and tested curriculum. Our program leaders learn how to deliver the program and commit to delivering the program with fidelity, just as they are taught, because the only way to guarantee the same good outcomes is to deliver the programs in the exact same way that the program was designed and evaluated. This video is to prepare individuals for the upcoming training to become a leader of this program. We'll start with an overview of the program itself, why it's needed, the proven outcomes, and the workshop's basics. Then we'll talk about the reach this program has had in Wisconsin and the team you're joining. And finally, we'll go over what it means to be a workshop leader, what you can expect from us, and what we hope we can expect from you before, during, and after the training to become a workshop leader. I'll now turn it over to a program expert who will provide the rest of the orientation information. But before I do, I want to take this opportunity on behalf of both WIHA and your local community to thank you for your interest in providing these workshops in your area. Let's go.
Hi, I'm Michelle Comeau, and I'll be overviewing elements of the Powerful Tools for Caregivers program today. First, let's talk about why there is such a need for this program. While caregiving often is rewarding, it can be very stressful. Caregivers are at a high risk of depression and stress-related illnesses, and it can be physically, emotionally, and financially exhausting. Often overwhelmed by taking care of others, most family caregivers don't realize the importance of taking care of themselves. So Powerful Tools for Caregivers focuses on the need of caregivers. Some facts about caregivers. There are over 40.4 million unpaid caregivers of adults age 65 and older in the United States. 9 out of 10 of these people in this group are providing care for an aging relative. Adults age 45 to 64 are most likely to be caregivers. On average, they spend at least 10 hours a week caring for their loved ones, and many will have to quit their jobs in order to manage this responsibility. 64% of caregivers say they do not go to the doctor because they put their family's needs first. And being a caregiver can impact your physical, emotional, and financial health and well-being. So, Powerful Tools for Caregivers program is here to help. Well, what is it? It's a small group, community-based workshop that meets once a week for 6 consecutive weeks. There are 2 versions. There's Powerful Tools for Caregivers of adults with chronic conditions, as well as Powerful Tools for Caregivers of parents of children with special needs. Powerful Tools for Caregivers can be held for 2.5 hours or a 90-minute format once a week for the 6 weeks, while Powerful Tools for parents of children with special needs is offered in a 2-hour format once a week for those 6 weeks. The program is led by 2 trained facilitators, also known as leaders, and it follows a highly scripted manual pre-made for leaders to facilitate the program. This is for unpaid caregivers, for example, family or neighbors, things like that. And a caregiver is defined as anyone who provides regular assistance to someone with their activities of daily living. So far, Powerful Tools for Caregivers has over 4,000 class leaders in 41 states and has reached over 70,000 caregivers nationwide. This is a high-level, evidence-based program that meets the U.S. Administration on Aging's highest standard for evidence-based programs. It was based on the fundamentals from the Stanford University's Living Well with Chronic Conditions program and is disseminated through a national office in Portland, Oregon. Over the years, it has had a variety of pilot testing of its curriculum, some refinement, and more research. And you can find more research outcomes on the national office's website or through WIHA for further resources. Research has been proven to help caregivers gain tools to take better care of themselves while caring for their loved one, bettering themselves to be a better giver of care. So these studies have shown that the program's outcome results in improvements to these 4 areas for family caregivers. Caregivers' self-care behaviors, so that means their increase in exercise, relaxation, and personal medical checkups. Also the management of their emotions, so reduction in their guilt, anger, and depression. Increase in self-efficacy, so that's increasing their confidence in coping with caregiving demands. And then increase in use of community resources. So that's the use of local services around caregivers' needs. This program has some underlying concepts. 1, caregivers have similar experiences and problems. Through these highly interactive workshops, participants will learn, listen, and share with each other over the course of the 6-week series. Another concept is that caregivers benefit from being with other caregivers and learning how to take care of themselves. Lastly, or second to lastly, lay leaders lead as effectively, if not more effectively, than healthcare professionals. So what studies have found is that when a health professional leads these workshops, participants will end up learning more. But if a peer leads this workshop, participants end up doing more, and the latter helps maintain those long-term behavioral changes. And lastly, the last underlining concept is that this program's process is as important, if not more important, than the subject matter. People learn best by being taught a little bit, having a chance to try things out, getting feedback, and then building on what they've learned. It's through this process that participants learn various coping tools while being supported by their peers. So who are these programs for? Well, the workshop is for family, not facility caregivers. So that's spouses, partners, also adult children of aging parents, and parents of children with special needs. The same good outcomes were seen for diverse groups regardless of the geographic area or types of caregiver the person was, or the living situation, financial, or the education background of that caregiver. So each session has one major topic for the group to talk about and get insights into, as you can see listed on the slide above. Some specific tools are relaxation guides, recognizing your stressors and how to deal with them, how to speak in I messages versus you messages, the Aikido communication style of finding common ground, also communication styles in assertiveness, dealing with negative self-talk, as well as decision-making models for families with tough decisions to make. Some other key elements that are part of every session are practicing problem solving and working towards decision making, also creating and completing individual weekly action plans, also known as short-term goal settings. And these goals are not only about the things that a person feels they have to do, like eating better, exercising, etc., but are really there to encourage someone to do something that gives them pleasure and brings back that joy, that personal enjoyment into their lives. Also important is group contributions that happens every session. The people attending bring a lot of feedback and ideas to support each other over the 6-week series. It's through this peer support that the group bonds, feels less isolated in their struggles, and gains confidence in using the tools discussed. This program gives caregivers tools to reduce their stress, guilt, and anger, as well as depression around caregiving, improves their self-confidence, helps them better be able to communicate their feelings and concerns, helps manage their time, set goals, and solve problems, also mastering their caregiving transitions. It increases the ability to make tough decisions, as well as communicate effectively with their care receiver, family, and healthcare providers. Lastly, it helps them locate and use local resources. In the end, time after time, the biggest takeaway is that the caregivers that attend this program feel better that they're not alone in the various aspects, mentally, physically, emotionally, financially, of being a caregiver. WIHA began offering and tracking data for the Powerful Tools for Caregiver program in 2010. Since then, our data shows that Powerful Tools for Caregivers has served well over 4,000 people in 37 counties and 2 tribes. But its beginning started even further back in the year 2000 through the UW Extension offerings. Some site examples providing these programs to the community are Aging and Disability Resource Centers, senior centers, healthcare providers, faith-based programs and organizations, recreational agencies, campuses, and tribal centers, just to name a few. These programs are lay-led by either past participants, employees, volunteers, some health professionals, and also caregivers themselves. Anyone who wants to help people on a better path towards healthier aging. So now that you understand the program itself, let's talk about the training to become a workshop facilitator, also known as a leader, of the Powerful Tools for Caregiver workshop. You'll attend the training in pairs or solo if your agency already has a trained leader in your area to co-facilitate with. It's 2 full days of training, starting at 8 a.m. and ending about 5 p.m. each day. There's a lot of information packed into these 2 days. So you'll be learning about the issue caregivers struggle with, as well as the impact that this program has on those who attend. You'll also learn the curriculum of the programs. So you'll see the trainers demonstrate key pieces of the 6-week workshop series in the 2 days of training that you are attending. You'll also be building on new skills like group facilitation techniques and management. And this also includes a practice-teach demonstration in front of your peers, as well as working through possible real-life workshop scenarios. You'll also learn the various ways you're supported throughout this process, locally and statewide, because we're all here to help. So you can see that missing even just a small piece of this training could greatly affect your full understanding of this program and its offerings. So again, you must attend the entire training to become certified in this program. Leader qualifications. We're looking for friendly individuals who enjoy helping people and can speak comfortably in front of a small group. Your time commitment is, again, you attend the 2 days of training, and then once you're a certified leader, you'll need to block about 4 hours a week when leading the 6-week-long series. This includes setting up for the workshop, actually conducting the workshop, and then packing things up. Some additional time during the week may be needed to prepare for the upcoming session and call your participants. This is a highly scripted program, meaning the information to be presented in the workshop is already set for you. So you'll have to be comfortable leaving that medical hat or those personal theories at the door and just follow the script as intended by the developers. And this is to ensure that the participants' voices are the ones most heard in the workshop. The training will teach you facilitation techniques and model skills to prepare you to lead your workshop with another certified leader. At least one of the 2 leaders must have experience with caregiving, either personally or professionally. And together you will help others learn skills to take better care of themselves and in turn be better caregivers. So people who are past participants of the workshop are strongly encouraged to become leaders as they've seen the impact of these programs firsthand. Expectations of leaders. So again, attend all of the 2-day leader training, work with your local program provider, lead a workshop in pairs, both who have been certified by master trainers, lead 2 workshops each year, adhere to the curriculum, use required materials for the workshop, as well as follow WIHA's protocols. So that means your workshop notification forms and the data collection process. All right, so this slide goes over the materials you'll receive at training, as well as the materials needed when putting on a workshop in your community. During the training to become a workshop leader, you'll receive a leader's tips manual that overviews the program's principles, methods, and materials, as well as gives helpful guides and tips to lead a successful workshop. You'll also receive program handouts and support tools for you, the leader. Lastly, you'll get a copy of the Caregivers Help Book. Now, the national office requires that only certified leaders have access to the leader's manual. This is the scripts and instructions needed to actually facilitate the workshop. Therefore, WIHA does not print and offer these scripts at the time of training. Rather, the national office will directly email you those 3 scripts after the training has ended. So the 3 electronic files are represented above, and that's going to be the 90-minute and 2.5-hour script for the Powerful Tools for Caregivers of adults with chronic conditions, as well as the 2-hour format for Powerful Tools for Caregivers of parents of children with special needs script. We understand that this process is a little bit cumbersome, but we do our very best to get your proof of certification of the training to the national office as soon as the training ends to shorten that lag in your completion of the training to receiving those electronic files. So that all being said, once you receive the program's scripts, you'll need to print out the version that you'll be using in your area. You do not need to print all 3 formats, just the one that you plan on facilitating. So connect with your local program provider for support in doing this. Charts are also required to lead a workshop. There are several ways to get, print, make, and show your workshop charts. All of this will be addressed at the training. In your workshop, you'll also need to have audio and visual capabilities, so be sure your space has access to a computer speakers, a computer itself, internet, and possibly a blank wall for projecting, unless you have a big TV screen. But we tell you all of this so that you have enough time from the last day of training to the first day of your workshop to get all your materials ready, because we want you to be prepared. Other materials I want to make note of is that you have a blank flip chart pads, painter's tape, markers, name tags, and pens accessible. also the ability to print participant handouts. Offering refreshments is a great courtesy to participants. So I'm going to turn this over to my colleague Jill Rankin to talk more about implementing this program in your area.
Hi everyone, my name is Jill Rankin and I work for WIHA as the Director of Program Provider Partnerships. I've been working with the self-management programs for 12 years now, and my role is to work with organizations at a leadership level in implementing the program in their communities. We here at WIHA do believe that organizational support is essential for program leaders to be successful in implementing the workshops, which is why my position is dedicated to organizational support. Another step in preparation for your training to become a workshop leader is working with your program provider organization and area partners to be sure that your workshops are a success. So to do so, WIHA has created a planning guide for you to fill out, making sure that you're covering all the steps and are planning ahead. But fear not, you are not alone. Michelle is going to be joining us later in the webinar to talk a little bit more about the great support team you have backing you up. But it's also good to know the tools. You can find the planning guide at the link provided on the Leader Training Schedule website page or at the beginning of the Leader Training application. In order to complete the planning guide, you'll want to start with two important steps. Number one, to identify your program provider organization, which we're going to talk about in a minute. And then number two, if there are other local program providers, be sure to make contact with them in an effort of collaboration. So in order to provide organizational support to our program leaders, we have a process that will engage local leadership through the program provider registration. So what are program providers? They are organizations that deliver one or more of the WIHA evidence-based healthy aging programs in their community. They employ program leaders or support volunteer program leaders. This does look different in every area. There might be multiple organizations working together to deliver the program, therefore multiple program providers in the area. So who is your program provider? If your employer is paying your time in facilitating the workshops, then they are your program provider organization. If you are a volunteer doing it unpaid, your program provider is the organization for which you are facilitating the workshops for. And then if you're on your own completely, we ask that you please contact us here at WIHA. We will either assist you in determining who your local organization is, that could be your program provider, or if that still doesn't apply, WIHA can be your program provider organization. Then how to register. It's a simple one-page form that's online. You'll contact myself, Jill Rankin, and it will include just simple things like your organization contact name and information, the WIHA programs that are administered in that organization, and the geographic area served. All registered program providers do receive dedicated organizational support from WIHA. So as previously overviewed, you and your registered program provider organization and possibly other partners in your area will be filling out the planning guide together. So as you work with your program provider organizations, you will plan the following in order to prepare for your success. First, you are going to select the dates and the times for your first workshop. We do find that people who come to the training with their first workshop already in mind and planned are able to take in and apply the information learned from the training and then implement it right away once they're back home. The sooner you lead, the fresher your skills are going to be and the less intimidating it will feel. Then you'll decide whether the workshop will be for free or for a fee and then how much. You'll select and reserve a venue with appropriate room arrangements, and our planning guide will go into further detail around what those requirements and recommendations are. You'll decide who's going to submit your workshop notification form to WIHA. That will be worked out with your supporting registered program provider organization. And then what agency will receive the workshop registration? It should be somebody who can speak about the program and help people with any questions that they have related to the program. So as you can see, there's a handful of considerations to discuss with your program provider organizations. When your workshop is scheduled, the next step is outreach and marketing. And WIHA's website does have lots of marketing templates already made for you to download and customize. Then you will want to figure out where and to who this outreach is going to be happening. Track what works best in your area. We are striving to register at least 18 people per workshop. We also do have data collection for this program, which you'll learn about in the training or directly after the training. You may also need to talk with your area about ways to fund and sustain the program. The materials are low cost, but a cost is a cost, so it's good to have this conversation early. So I'm going to sign off and give the next slide over to Michelle, and she'll talk a little bit more about leader support.
Hi, I'm Michelle Camo, the Director of Leader Development at WIHA. Over the last 10 years, I've been a leader, a trainer, and a coordinator of these programs, and I'm thrilled that you're considering being part of such an impactful program. Now, I know you just received a lot of information, and let me reassure you, it's all in an effort to see the bigger picture of these amazing programs. Further, we want you and your community to feel ready for the training and ready to begin workshops. The last few slides will overview the support that's there for you as a leader, because the training is only part of the support that we give. So after the training, there is a post-leader training meeting, and that's held over the phone, and they happen about 6 to 8 weeks after your training. And this is a check-in rather than a check-up. We'll review a few WIHA-related items, but mostly it's there to hear from you and your fellow trainees about how things have been going since the last day of your training. We also have a leader section on our website where you can find all the great resources, current handouts, and whatever else is needed to plan, organize, and prepare you for your workshop, start to finish. We also have a leader listserv. So after the training, your preferred email address will be added to this leader listserv or discussion board, and it's a group made up of all the active leaders around the state in this program. It's a way to share, discuss, and get events or other important program updates from WIHA. We have technical assistance because technical assistance is really important for the success of this program. No leader should be flying solo. So building a local network of partnered program providers will not only be great support to you, but it also ensures the program's success and in turn improves the health of your community. The more people that hear about it and learn about this low-cost, effective community wellness workshop, the better. If you don't know who your local program provider point person is, please contact myself or Jill Rankin. So WIHA staff are also available to help you with any questions. If you're confused about the curriculum or need advice about a certain situation, we're here to help. There's no wrong door. And if we don't have the answer, we'll definitely find somebody who does. But this office is a wealth of knowledge and has some really wonderful resources at our fingertips. All of our leaders and coordinators around the state. So periodically, we'll be offering webinars about this program, and the topics may be about best practices or highlighting a local area about their bright idea or showcasing a new concept to try. Announcements about these offerings will be made on that leader listserv. So we want you to know how much we value your commitment and that we're here to help. I hope you're feeling prepared and excited. All right, so are you ready to become a leader of these workshops? Your first step is to complete the leader application found on our website to save your place at the leader training because space is limited. You're going to need to commit to the requirements outlined in that application, and you'll be sent a copy of these requirements with your application confirmation. There is a cost to the training, and you can pay that by credit card during the application process or select the invoice option, and invoices are sent after the training concludes. As Jill discussed, you're going to need to fill out that planning guide with your registered program provider in preparation for conducting your first workshop. And lastly, keep eyes out on your email. We'll send a confirmation that we've received your application. Then, once reviewed by staff, you'll receive an approval email confirming your place in the training and outlining all the logistics and the details around the training, like the time, the location, any pre-homework or expectations. And then lastly, you'll receive a reminder email closer to your scheduled training. Thank you for your attention today. If you have any questions or concerns, contact us. We gave a lot of information, and it's better to ask than be unpleasantly surprised later. A secondary big thank you is for being interested in this impactful work. These programs are valuable medicine for your community. Your success betters their health and their well-being, and we couldn't do it without you. So get those applications in, and we'll see you at training.